Hello and welcome to Wellness Watch, a show that explores the nuances and the burden of illnesses and diseases on mankind and how we in India are dealing with it. We know that cancer does not whisper, it strikes. Often called the silent killer, lung cancer is one of the deadliest diseases in the world, not because it's the most common, but because it's so often invisible until it's too late. By the time the symptoms appear, a persistent cough, shortness of breath, chest pain, the cancer has often spread, leaving limited options for treatment. Smoking remains the leading cause, but non-smokers are not immune either. Pollution, genetic factors and workplace exposures can all play a role. Today in Wellness Watch, we discuss lung cancer and its prevention. I'm Preeti Kaur. Lung cancer remains a leading cause of cancer deaths globally. What are the key types of this disease and how we can prevent it? Well, early detection is the key, with smoking as the primary risk factor. What steps can individuals take to reduce their chances? Join us as we explore the latest insights on lung cancer prevention and treatment. Let's take a look at this report by Sujata Lochab.
Lung cancer is one of the leading causes of cancer-related deaths worldwide. But what exactly happens inside the body when someone develops lung cancer? Let's take a closer look. First, imagine your lungs, two spongy organs that help you breathe and supply oxygen to every part of your body. Normally, lung cells grow and divide in a controlled way. But with lung cancer, something goes wrong. It all starts with the uncontrolled growth of abnormal cells in the lung tissue. These abnormal cells don't follow the usual rules. Instead of dying off when they should, they keep multiplying, eventually forming a mass known as a tumor. Now, these tumors can interfere with normal lung function. As they grow, they take up space, making it harder for your lungs to work properly. You might notice symptoms like persistent cough, chest pain, or shortness of breath. Sometimes people don't have symptoms until the cancer is already advanced. Lung cancer doesn't always stay in the lungs. One of its dangerous features is metastasis, the ability of cancer cells to break away from the original tumor, travel through the bloodstream or lymphatic system, and start new tumors in other parts of the body. This means lung cancer can affect places like the brain, bones or liver, making it even harder to treat. Let's break it down. There are two main types of lung cancer: non-small cell lung cancer and small cell lung cancer. Non-small cell lung cancer, or NSCLC, accounts for about 85% of all cases. It's further divided into three subtypes: adenocarcinoma, squamous cell carcinoma, and large cell carcinoma. Each subtype has its own characteristics and treatment approaches. Adenocarcinoma is the most common type, often found in people who smoke, but it can also occur in non-smokers. Squamous cell carcinoma is typically linked to smoking and tends to be found in the central part of the lungs. Large cell carcinoma is less common but can grow and spread quickly. On the other hand, small cell lung cancer, or SCLC, is more aggressive and is almost always associated with smoking. It tends to spread rapidly, making early detection crucial. So, what does this mean for prevention? Here's the thing: the most significant risk factor for lung cancer is smoking. Quitting smoking can dramatically reduce your risk, but it's not just about smoking. Exposure to secondhand smoke, radon gas, asbestos, and certain chemicals can also increase your risk. Regular screenings, especially for those at high risk, can help catch lung cancer early when it's most treatable. Now let's talk about treatment. The approach to lung cancer varies based on the type and stage of the disease. Surgery is often an option for early-stage non-small cell lung cancer, where the tumor can be removed. Chemotherapy and radiation therapy are common treatments for both types, especially when the cancer has spread. Targeted therapies and immunotherapy are newer options that can be effective, particularly for specific genetic mutations found in some tumors. What this really means is that there's hope. Advances in research and treatment are making a difference. Lung cancer is a serious disease, but understanding it is the first step toward prevention and treatment. Sujata Lochak for DD India.
All right, each year lung cancer claims more lives than breast, colon and prostate cancer combined. And yet, it still doesn't always get the same attention. That silence, much like the disease itself, is deadly. In 2025, lung cancer is estimated to represent 11% of all the new cancer cases in men and 12% of all the new cancer cases in women. Lung cancer is a significant health challenge in India as well, accounting for 5.9% of all the cancers and 8.1% of cancer-related deaths, with smoking being a primary risk factor. The theme of World Lung Cancer 2025 is Stronger Together, United for Lung Cancer Awareness, emphasizing on the importance of collective action in the fight against lung cancer. Today in Wellness Watch, we look for these answers. What is lung cancer? What are the symptoms? We try to understand, is lung cancer aggressive? Can lung cancer be cured and prevented? And we also try to explore the medical advancements in India. All right, the basic idea of the show is to showcase India as a medical hub to you all. And also, while prevention is the key, as we know, progress in cancer treatment is also critical. Government hospitals in India play an important role in providing affordable and accessible lung cancer care, particularly for underprivileged population. Patients can access facilities like LDCT screening, AI diagnostics and free biomarker testing for cost-effective treatments. Up on our screens, we have some hospitals and centers that particularly cater to lung cancer. Kidwai Memorial Institute of Oncology, Bengaluru, Tata Memorial Hospital, Mumbai, All India Institute of Medical Sciences, that is AIIMS, New Delhi, Postgraduate Institute of Medical Education and Research, that is PGI-MER, Chandigarh. All right, to help us understand lung cancer better, its prevention and cure, we joined in by guests. We joined in by Dr. Arvind Kumar, Chairman, Institute of Chest Surgery, Vedanta Hospital, Gurugram. And we're also joined in by Dr. Sabita Jivnani, Professor of Thoracic Oncology Surgery at Tata Memorial Center, Mumbai. Thank you so much, both of you, for joining in. To begin with, Dr. Arvind, I would want you to explain to our viewers in very simple terms, what is lung cancer, though we did show a detailed report on this, but what is lung cancer and what are the stages of lung cancer?
Preeti, first of all, thank you very much for having me on this show and discussing the topic of lung cancer, which I think is a very, very pertinent and very important topic today. As was elegantly shown in the report which you showed, lung cancer is basically an uncontrolled growth of cells inside the lung, which could be in any part of the lung from top to bottom, left to right, and could be on either of the lungs. It need not necessarily be actually in the lung tissue. It could also be in the air passages, like the windpipe, which starts just below the voice box, goes down, divides into two. So any tumor, whether it's in the windpipe or the smaller bronchi and in the lungs, they are all clubbed together as lung cancers. And there's, as was shown, there are two types, non-small cell and small cell, and non-small cell is again divided into adenocarcinoma, squamous carcinoma, large cell carcinoma, and the other is the small cell. When it comes to staging, which is a very, very important aspect of lung cancer, for the better understanding, I would say that there could be broadly 4 stages. That's how we in our scientific literature describe it. We use a system called TNM. Now, T stands for tumor, N stands for lymph nodes, which are glands where the tumor tends to spread from the lungs, and M stands for metastasis. But I won't go into the details of T and M. I would summarize it by saying that for broad understanding, you can say stage 1 is a tumor which is a small tumor, is still confined to within the lung. Broadly speaking, stage 2 could be a tumor which is either a larger one within the lung or has spread to glands, but which is within that particular lobe. It has not gone to the distant lobe. So, small tumor in the lung is stage 1, a little bigger tumor or has spread to neighboring gland, stage 2. Stage 3, when the tumor has become bigger or it has spread to the glands in the center of the chest, and stage 4, when it has gone beyond the lung, beyond the chest to opposite lung or to other organs, which could be brain, bone, liver or any other organ in the body.
All right, I'll take that forward to Dr. Savita. Dr. Savita, sir explained to us very, aptly what are the stages. How and at what stage does cancer spread, and can it be detected early?
So cancer starts spreading from the day the cells start dividing in the tissue, and there are some alterations in the genes in the DNA, which when a cell starts proliferating, there is a cell cycle and it should stop. But they get out of control of the usual mechanisms, the cancer cells, and that's how they keep growing. So from day 1, when you have a cancer cell in the body, it can start spreading from that time. But in certain conditions, it can spread faster, depending on what kind of alterations are there, what stage it presents to the clinic, and also if the person has been a smoker or not. So certain types of cancers like large cell and small cell cancers, they spread faster, they spread more widely, whereas the other cancers will take some more time to spread. Also, coming to your second question, it is possible to detect lung cancer early, and we have evidence from multiple trials which have taken place in North America as well as Europe, where if you have people who have been smoking for more than 20 years, who are in the age group of 50 to 80, and they have smoked more than 20 pack years, that is smoking 1 pack of cigarette per day for 20 years, these people are especially at high risk for developing lung cancer. And in these patients, we can offer them something which is known as low dose CT screening. So this is an investigation which can be done in 3 to 5 minutes. It has a very low dose of radiation compared to the normal CT scan. And in all these high risk individuals, they can undergo a low dose CT screening, which can tell us if there is anything developing in the lung. Now, many people will ask, why not chest X-ray? Why always go for a CT scan, which is not so easily available? The thing is, with the advent of COVID, CT scanners have become more available, and even the general physicians, general public is aware of CT scanners. And X-ray, on the other hand, if there is a lesion which is less than 3 centimeters, 80% of the time it cannot be picked up by X-ray. So if you really want to detect it early, in stage 1, as sir explained, which is a tumor which is less than 3 centimeters and not spread anywhere, then low dose CT screening at present is the best tool that we have.
All right, so early detection is the key. Dr. Arvind, what are these early symptoms that one should look out for? Coughing, chest pain is what we showed in our report as well. These are some symptoms which we generally face in our day-to-day lives, and we generally prefer taking drugs which are easily available in the markets. Having said that, when is the time to see a doctor, particularly for the symptoms of lung cancer?
Before actually answering your question, I would say that unfortunately in lung, cancers can grow to very big size and not produce any symptoms. They can metastasize all over the body and still have no symptoms, and we are seeing it now time and again. Somebody was to go for immigration, so goes for a chest X-ray, suddenly detected to have a patch, and then advised to do a CT scan, PET scan, and you find tumor spread all over, and patient says that they argue with you that I have no problem, I have no symptom. So first of all, I would like to highlight that it can actually be asymptomatic, have no symptoms till quite late, because lungs are very big. If you have a small tumor developing, sometimes it doesn't, or it produces mild cough. The fact is that all of us cough quite frequently otherwise also. So a cough which is present occasionally may not always be taken as an evidence. So this is a big segment, and nowadays with the COVID affected population sometimes getting these screenings done regularly, as Dr. Sabita mentioned. So some of these tumors are being picked up on the CTs which are being done for evaluation of post-COVID situation. So that's one category which needs to be picked up, and I think there is a role for the similar kind of low dose CT screening which Dr. Sabita so elegantly described in our country also, where possibly the inclusion criteria of the number of pack years and the age etc. might need to be reduced, because we have much higher pollution exposure also.
Yes.
It's not just smoking, it's pollution also, but that's an area which is the area for further workup. Coming to symptoms, the most important symptom is a cough that does not go away, a persistent cough, blood in the cough. I would like to highlight that blood in the cough is a sinister symptom and should never be ignored. Time and again we have patients coming and we ask them, did you ever have blood? Oh yeah doctor, maybe about 6 months back it came, and then once in a while. So we thought, since it's once in a while, why bother about it? Blood present in cough ever is a sinister symptom. Yes, in our country tuberculosis is an important cause for that, but please remember, blood in the cough in India, every case is not tuberculosis. There is a strong case today when we are seeing lung cancer in younger individuals. I have seen lung cancer in people in 30s and even people in 20s. So in this situation, if you see blood in the cough, then there is a role for further investigation to confirm that it is tuberculosis before people are put on anti-tubercular treatment. We see patients who presented to doctors, it was presumed to be tuberculosis, and they were put on anti-tubercular treatment. Many months were lost, and by that time the disease became late. So I would repeat, cough that does not go away, blood in the cough, these are two important symptoms of early lung cancer. By the time it produces pain in the chest, it has already spread to pleura, which is the lining of the chest, which is not early, which is then late stage cancer. And when it spreads to other organs in the body like brain, lung, other lung, liver, kidney or bones, it is already metastatic. So for early detection, one is that high risk population CT screening is an important method, and two, cough that does not go away and blood in the cough. If these two symptoms are given due importance, we will be picking up more early lung cancer than we do today.
Very aptly explained, sir. I'll take that forward to Dr. Savita. Dr. Savita, is lung cancer aggressive? Because sir says that lung cancer can be detected as early as 20 or 30 years of age. If a person, gets lung cancer, what are the chances of its spreading quickly or rapidly to the rest of the body? How aggressive is this form of cancer?
So usually lung cancer is more aggressive than other malignancies. When you compare it to other cancers in the body, lung cancer is generally more aggressive. And there are subtypes, like I mentioned earlier. Small cell lung cancer is one of the most aggressive. Then also large cell cancer is aggressive. Even some certain subtypes of adenocarcinomas can be aggressive. So they can spread quite rapidly. And like sir mentioned earlier, most of the patients in India present to us very late. So at Tata Memorial Hospital last year, when we saw 2,600 patients with lung cancer, out of these 70% were in the metastatic stage. That means they were already stage 4 and we could not do much for them. There was no cure possible. And out of those other 30% also who have come in a relatively earlier stage, you can operate only on 8 to 10% of the patients, because they are the only ones who are in the early enough stage and who are fit enough. So lung cancer presents late. It is often asymptomatic. It is an aggressive cancer and it can insidiously spread without the person realizing that he has something going on inside. Sometimes we have, like sir was saying, patients who have 10 and 15 centimeter tumors and they have just been, attributing the symptoms to something completely unrelated, like cervical spondylosis or some back pain. But when actually there is a tumor sitting over there, compressing those nerves and causing that pain, which does not go away.
Right.
And also, yeah, so these are some things that, we cannot ignore in lung cancer. It is pretty aggressive.
All right, sir, is it always smoking or external factors that lead to lung cancer? Is lung cancer hereditary?
So I'll give you an analysis that we performed about a year back. 30 years back when I started my career, at that time majority of the lung cancers who were presenting to us were smokers. They were mostly men and they were mostly in 50s and 60s. So it was known as a disease of elderly smoker men. Last year when I looked at my data, I found that the smoking, non-smoking incidence is now nearly 50-50. That half of my patients are actually so-called non-smokers, and I use the word so-called because I strongly believe that in a polluted city there is no true non-smoker. Because of pollution all of us are smokers. So that's one. Two, 40% of my patients were women, and the peak age has now come down to 40s and 50s. 10% of my patients are in 30s, and youngest patient I have operated is a 24 years old boy, non-smoker. So from elderly smoker men, we've now come to smoker as much as non-smoker, younger population, women not as much but slightly less than male, and more numbers of lung cancer. So overall, if I was to summarize, what we are seeing in India is a rise in total number of cases, lung cancer cases, rise in non-smokers, rise in women, and occurrence at a younger and younger age. And as Dr. Sabita so elegantly described their Tata Memorial data, where 70% of the 2,600 cases were already metastatic. Now, partly it is because of the aggressive nature of the disease, but somewhere misunderstanding and wrong treatment is also to blame. So as patients develop symptoms, when they have cough and blood in the cough, they are often labeled as tuberculosis.
So lung cancer cannot be hereditary?
Lung cancer is not a known hereditary cancer where you know that it's a very strong association. There could be isolated reports where there could be a slight prevalence, but if you ask me, is it a hereditary cancer? The answer is no. But apart from smoking, now I think in our country at least pollution
Other
is
factors are
emerging
also
as
playing
a
a very
very
important role.
factor.
All right, Dr. Sabita, can newer types of medicines, in fact, such as targeted therapy, immunotherapy, to what extent are they beneficial in treating lung cancer?
So lung cancer treatment actually has come a really, really long way. I started my cancer surgery training in 2005, and then when we saw a patient with lung cancer, we used to tell them you have less than a year to live, probably 6 months. But now we see patients even in stage 4 who are living for years, and provided they take the proper treatment and they continue the treatment, they complete the treatment. So there are a lot of advances. There are a lot of genetic mutations which are found in lung cancers, and these can be detected by next generation sequencing and also a lot of other molecular tests. Anybody who has the genetic changes in their tumor tissue, they are eligible for something which is called as targeted therapy. The most common gene which is mutated in Indian patients is something called as EGFR, and almost 25% of Indian patients, especially women and non-smokers, will have this mutation. So instead of taking injection chemotherapy, even in stage 4, these patients can get targeted therapy, which is a tablet which is taken once or twice in a day. Last 5 to 7 years, we have seen the advent of immunotherapy, which is still quite expensive and not afforded by most of our patients. But that also has given very good results in all stages of lung cancer. Even in operable lung cancer, if you give it before surgery and after surgery, it improves the survival.
All right, Dr. Arvind, would you also add to it the medical advancements that have been made in India, but very briefly?
I would, Preeti, go a step back and say there are 3 major modalities. Number 1 is surgery. Number 2 is systemic therapy, under which you have chemotherapy, you have targeted therapy as Dr. Sabita described, and immunotherapy, which also she described, and the third is radiotherapy. So in surgical fields, there have been a lot of advancements too. The systemic therapy advancement she has described. Surgery, unfortunately, as she said in their series, was possible in only about 10%. These are cases which are the tumor is confined to the lungs and the glands. Those cases can be operated. And here there have been a lot of advancements. Earlier we used to operate by open surgery, where we would rip open the chest and put our hands inside and do the surgery. But now it is possible to do them with robotic assistance, with very small cuts, thereby inflicting much less trauma on their body, quicker recovery, less pain, and there are data to suggest that these patients may have better survival also, because their immune system is depressed less due to less trauma.
All right. So today we're discussing lung cancer. We're joined in by Dr. Arvind Kumar and Dr. Savita Jivnani. Both of them explained to us the severity of this lung cancer. But to help our viewers understand it much better, we will have a quick rapid fire question round. I'll ask you to give very brief and crisp answers. Dr. Arvind, lung cancer is always fatal. Is it so?
No, if it can be detected early, it can be cured also.
Dr. Jivnani, lung cancer only affects the older adults?
Not at all. In our country, more and more younger people.
If one shows no symptoms, that means he does not have lung cancer, Dr. Arvind?
No, you can have lung cancer, even metastatic lung cancer, and have no symptoms at all.
Vaping, e-cigarettes, cigars, low-tar cigarettes do not lead to lung cancer, Dr. Jivnani?
They do lead to lung cancer. They are equally, if not less harmful than cigarettes, and they should be avoided at any cost.
Treatment of lung cancer is toxic and worse than the disease itself. Is it so, Dr. Arvind?
No. Treatment sometimes leads to cure. In many other cases, leads to a good quality, prolonged survival. So therefore, it's not worse than disease.
Advanced lung cancer cannot be cured, Dr. Jivnani?
We are seeing more and more patients who are being cured even with advanced lung cancer by combining something called multimodality treatment. You give chemotherapy, you give surgery, you give immunotherapy and radiation. You combine everything. If the patient can tolerate it, they can do well.
All right. On that note, we'll end this discussion here. Thank you so much, both of you, for joining in and helping us understand lung cancer better. So for our viewers, after the discussion, we did understand that with early detection and modern therapies, lung cancer is no longer as daunting as it once used to be. Today, science is catching up. Targeted therapies, immunotherapy and early detection, as put forth by our specialists on the show, are rewriting what survival can look like. But remember, awareness, prevention and timely action remain the most powerful weapons as we have against one of the most unforgiving cancers of our times. On that note, we'll end this edition of Wellness Watch here. Thanks for watching. Take good care of yourselves till we meet next.